Well, thank you, Dr. Broderick, for inviting me. You've been very inspiring to me on Instagram because you're younger and the Instagram crowd is a lot younger. But I love it because it's how I connect with my kids and my grandkids. And so I've been wanting to do more on there. So I was just saw that you followed me somehow and I was like, oh, and then you started providing all this really awesome content about sleep and insomnia. And in fact, you're a neurologist, board certified in sleep, and you're have behavioral sleep medicine specialist, which is super cool because you don't usually see a lot of sleep physicians that also specialize in the CBT-I, which is the cognitive behavioral therapy for insomnia. So yeah, so thank you for, I basically just wanted to get on here and help your audience understand Inspire. And I wanted my audience to get to meet a sleep doctor from Seattle, right?
Yes, I'm in Seattle.
Yeah.
And I think the behavioral piece is kind of underutilized. And I just, because of my training at Stanford, I was able to get both. But yeah, thanks for the shout out.
Well, you know, it's really interesting because they've always been separate, right? And it's really important, especially with obstructive sleep apnea. There's a lot of patients who complain of insomnia, but it's underlying, right? The obstructive sleep apnea is kind of the first culprit, but then once you start treatment, some people either just love it and they're fine, or they have trouble. They have trouble with CPAP. I believe the cognitive behavioral therapy piece goes even with CPAP adherence, like getting people to use CPAP. And everybody know, you know what I was just saying this morning, because I spoke to the Mesa Chamber of Commerce here in my city. And I was just saying, do you realize that a year ago, like 95% of the public didn't even know what an O2 sat was? And now everybody knows what an O2 sat is, right? Because of COVID. Yeah. And it's through my own health struggles that I became a respiratory therapist. I mean, I was diagnosed with rheumatoid arthritis at age 8. By the time I was 26 and pregnant, I had Burkitt's lymphoma, which they wanted me to terminate my pregnancy. I had a 2-year-old, a 4-year-old. I was really sick, in and out of the hospital, a lot with pneumonias. I survived that, and I had already started my little business called Valley Oximetry, doing O2 sats on patients at home in 1990. That's how long I've been doing this.
Wow.
Crazy. And then I told my husband, like, because he's a therapist also, and we met in school. And I said, Glenn, look at these overnight oximetries. This is sleep apnea. You know, this is, again, in 1990. Were you even born? Yeah, you were. You were 10.
Oh, yeah. I was older than 10. But
yeah. So the sawtooth waves that we see where your oxygen sat will drop at night when you stop breathing. And I don't know what public here we're talking to. So thank you for all the doctors on Meredith's side that have joined, and for all of you have heard my story 100 times. Thanks for listening again. But basically we saw the O2 sat, the sawtooth waves. And I was telling Glenn, this is sleep apnea. We can't oxygenate a collapsed airway. These people need sleep studies. They need CPAP. They need airway split. And so that's kind of how we started. And I always had this idea that I could become a sleep tech and learn. Plus, I was just fascinated by the physiology of all the things that happen. I mean, oxygen saturation is one small little piece of like 20 different parameters that we're looking at in a full night sleep study, right? We're not talking about home sleep tests. We're just talking about full night in lab sleep studies. And I wanted to learn it. I was so excited to learn. So after I survived Burkitt's lymphoma for 5 years, because that's what they told me, if you make it 5 years, you're considered cured. I went into the sleep center here in Phoenix and learned, and then went to work for a guy, kind of directed his little 2-bed lab, grew it from like 12 studies a month to 60 studies a month. And I was like, we can go big, you know? And so he didn't want to go big. So I went home and we started our own, and here we are, oh gosh, 36 beds later. We're on our 7th center that'll open in Tucson. I think we have 12 providers. We're diagnosing all sleep disorders, we're doing CBT-I, and I have a sleep to slender program. So we're helping patients, because most of our patients, right, Dr. Broderick, are overweight. So
great.
we have a weight loss management program now that's covered by insurance, because if you have obstructive sleep apnea, your insurance wants you to lose weight. So we use our nurse practitioners to help guide you through weight loss. But anyway, back to my personal story, which is really why we're here to talk about Inspire, is I knew that I probably had sleep apnea after going and learning. So by age 30, I'm pretty sure I have sleep apnea. My dad snored like a herd of elephants. We used to die. We'd hear him all the way underneath, the house everywhere. And, I started to notice that I was snoring and I wasn't so tired during the day. And this is really important. Sleep apnea is often really missed in women. Like, I don't fit the phenotype of obstructive sleep apnea. I'm thin. I'm tall. No one would ever know that I have an AHI of 64 without treatment. Like, I'm severe. That's really bad. So anyway, I finally got diagnosed at age 30. I was kind of positional, so I could sort of just sleep on my side.
Do you remember what your AHI was when you were 30?
Like 25.
Okay, so pretty significant.
Yeah, but I was in denial, like, oh, I'm fine. So I wore an oral appliance for a while, but then that stopped working. I'd snore right through it. And, honestly, it wasn't until 2015 when I got diagnosed with my second cancer. I had breast cancer, HER2 positive, and which was aggressive, and I needed more chemo. And I mean, they were literally like, you're no chemo virgin. We don't know if you can handle this. I mean, February 22nd will be my 6th year of my diagnosis.
Oh, wow.
I can't believe I'm still here. I literally thought I was going to die in this house. Like, it's crazy that I'm still here. And anyway, so I finally said, I have to take this seriously. Like, I know that my sleep apnea, untreated, because I've untreated it, has led to like my health issues. I mean, nobody will tell you got cancer from untreated sleep apnea, but it causes so many underlying, my inflammatory, the rheumatoid arthritis. My rheumatoid arthritis has been in remission for going on 6 years from the chemo. But yet I think because I finally treated my sleep apnea, my inflammatory factors are under control. My body is restored at night, which is so important. And now you're just hearing all over the media about you have to sleep. If you don't sleep, you're not going to have good health. And your days are numbered, and it's sad that we're in this pandemic, but I am thankful that it has brought to reality to people that they need to make their sleep health the number one priority, because if you don't sleep, none of it matters. You can diet and exercise till the cows come home. And anyway, so I watched Inspire for the last 5 years because I thought, ooh, maybe I'm a candidate. Well, then I thought, no, I'm not, because it's not MRI compatible and I need MRIs because I have breast cancer. And in 2018, I got another pneumonia. I get these pneumonias. And when I got the pneumonia, I thought, they thought it was pneumonia, but they wanted to make sure because it looked a little different. I have breast cancer. Anytime you have pneumonia, they're sending you to the cancer doctor and pulmonologist. And so yeah. I got a PET scan. And so that's when I realized, well, if they think my cancer's metastasized, I'm getting a PET scan, not an MRI. I'm getting Inspire, And the other thing is I didn't know if I could have it up in my chest because of my reconstructions and stuff. Well, the ENT was able to put it axillary, like on the side. He went through my same mastectomy scar and implanted. So this is what it looks like, little pacemaker type.
That's great that you have that.
Yeah, I brought it for everyone to see. So this
and show where they usually put it.
So they usually put it just kind of like right here, where like you see people with a pacemaker. Mm-hmm. So even, I'm pretty thin. So it would probably be a little bit of a bump on me because my port was kind of a bump. But I have a friend, Joanne, who has it, and you can hardly even tell. But I think with me, with my double mastectomy, it would have been a problem putting it up here. So they put it over here. Again, you can't even tell. In fact, I joke with the ENT, are you sure it's in there? Because I can't feel it. It's underneath. And so basically it comes with a remote. So once you have surgery, safe outpatient, 3 incisions. I was in the surgery center like 4 hours from start to finish. And then it comes with a remote. So they send you home 30 days to recover. And basically, once you're all recovered, you come back to the sleep center where we activate you. So ENT does the surgery, sleep, at least this is how we do it in my model. We do the activation because it needs managed, right? So once we activate you, your remote will work, right? So your remote comes with, this is your on button. And I'll show you guys before we get off sort of what happens when you turn it on. And then this is your off button. Here I'm showing you guys over here, on, off, and then you have plus and minus, plus and minus, plus and minus. So once you get activated, you get these, we kind of set you where you'll have some effective, comfortable settings where you can kind of go up and down. And then based on how you feel or how your bed partner is witnessing your snoring, you can use snore apps or just turn your recorder on your video to determine, where you should be. So 30 days after we activate you, then we send you home for 90 days. And then you work with the device, but you come in like 2 weeks after to the sleep center. We download this device, it plugs in. Just like CPAP, we look at your adherence to see how you're doing, to make sure that you're wearing the therapy all night, every night. We don't want to leave anyone behind. And if you're having trouble, then we talk about it and we can make changes. And the really cool thing about Inspire is it's customizable to each patient's airway, right? So some people need a little bit, there's all kinds of different electrode settings. I never even learned about this until I got it myself. And again, 5 years it took me to convince that this was effective therapy. I was super skeptical because as a sleep tech, anybody that came from ENT when I was a sleep tech, it was always, oh, I had surgery and now I snore again, right? So I was skeptical, but I finally believed in it and got it. So I came home for 90 days and worked on it. And the reason why I mentioned the Insomnia and the CBT-I is I can kind of be an insomniac, especially with what all I've been through with the breast cancer. But I kind of learned through my own training. I did some yoga nidra training, relaxation, breath work, those things. So I knew what to do if I did get insomnia from the device, because it is like electrical stimulation in the back of your throat. So how it works is this has some lead wires, right? So one will kind of go down around the rib cage and then they thread it up through the throat. So I have a scar kind of right here that you see. And then they put a cuff on the hypoglossal nerve. And then what that does when it's activated is it stimulates the back of the airway, pushing the tongue forward and the soft palate out of the way. And again, they have different settings for different airway types. So there are some indications. You have to be moderate to severe sleep apnea. You cannot be significantly overweight, but we've been telling people, we have a weight loss program. Will help you get your BMI down to where you could qualify because your insurance wants your sleep apnea treated. I mean, you are more of a risk to them with untreated sleep apnea. So a lot of this is all covered. There's 95% coverage rates now in the US or coverage policies on Inspire sleep therapy. But basically that stimulation in the back of the airway, you get a sleep delay. So you can set I have 30 minutes. So basically I'll turn it on and then I get 30 minutes to fall asleep before it kicks in. And it doesn't typically wake me up, but if I've had a stressful day and I didn't do my meditation or I'm not relaxed enough and my cortisol is a little higher than it should be, I have to pause it. So you just press this again and then you go back to sleep. Or if you get up to go to the bathroom, you just pause it, get a drink of water. I can actually drink water with mine activated. Some people, you'd spit it all over.
How long did it take you from when I think it says in the clinical trial they did with it that people will have a little bit of discomfort, maybe tongue soreness or discomfort with stimulation. How long does it last until you kind of get used to it?
That's a really great question because I actually had that. Like mine was dragging across my teeth and it was cutting my tongue. And so
do you have to wear a little bite guard then? Or
I tried that, but I was just still, so I just went back and I kept telling, my doctor, it's bothering me. I have this, you could see it on my teeth. Oh, well, let's just, And Inspire, the education that my team has received from them has been epic. And they just trained Dr. Mohan on how to make the changes so that that wouldn't happen anymore. So that's what's so cool about it is
So adjusting the settings.
Yeah, they just
what
adjusted
fixed it.
And
Okay, that's great.
You have a programmer. So, if you were to do this, with your patients in your practice, you'd get a programmer and you would learn how to do, and they certify you. They have a great training program. And I think actually our Valley Sleep Center is going to be in the future an education center for physicians like you who want to come and learn and see how we use it. But basically, I was what they call a yellow patient. Like I wasn't the green patient that would be, this is life-changing at first. It took me a while to get used to it. But once they got my settings right and I used the therapy all night, every night, this is what's so cool is it actually remodels the airway. If you think about a muscle, if you use the muscle over and over and over again, it changes it. And our airways part of it is muscular. And so my husband, he kept saying, you're still snoring a little bit. You're still snoring a little bit. And then all of a sudden, they made those changes. And then, 30 days later, he's like, you're not snoring anymore. So, I was talking to Michael Coleman, who's, on the team of Inspire. And he's like, yep, that's what it does. It actually changes your airway. And
now, did you have the drug-induced endoscopy beforehand? Okay.
Right.
So that's something for people listening that I think all the ENTs, that's part of the protocol, right? Because it was part of the study to make sure that
right.
you don't have concentric collapse, because then it may not work as well for you, right?
Exactly. So one of the indications is that you have to do a drug-induced sleep endoscopy where they go in and they actually look at your airway to make sure that you're collapsing front to back and not side to side. Am I saying that right? Yeah, I'm saying that. Yeah. So people with larger necks sometimes will collapse this way. Well, they're not Inspire candidates.
Mm-hmm.
You can't have that concentric collapse. Am I saying that right?
Yeah, where it collapses pretty much all around. Yeah.
Yeah, right. So so I had that done. I even asked the ENT, is there any other surgery that might help open up my airway? Because we have to do that sometimes, right? Sometimes there's sort of dual therapies that help the patient's airway really get maximized opening. And he's like, nope, you are the perfect candidate for this. And so now for the first time, and I've had it, it'll be February 18th will be a year since I was implanted, activated in March. So I spent a lot of the summer struggling, going back and forth with, getting my settings changed. But then, so my apnea, hypopnea index overall, once, and again, this is counting some delayed time, it was 3.8, but my optimal was 1.3. I'm under 5. I went from over 60 to under 5.
Wow, that's really dramatic.
Yeah, super. And it's so much better that when I travel, I just throw this in my suitcase. I turn the batteries upside down. When I go through security, I just say, I have a pacemaker. So they put me through the, this scanner. I don't even say I haven't spotted. They'll be like, what is that? I say, I'm a pacemaker. They're like, okay, go over here.
Life easy.
Yeah, makes life easy. And you can have a pacemaker and Inspire. You can have both. So usually they put pacemakers on the left, then Inspire would always go on the right. We have several patients that have both. The main thing is just getting that apnea treated. And I was embarrassed that I couldn't wear CPAP. Here I am, a respiratory therapist, and I just want to encourage you, don't be embarrassed.
Can you speak about that a little bit? What it was about it, and how did you come, the process of going from I'm actually done with it and I'm gonna just let go and I'm gonna move on. Tell me a little bit of that process for you. How did you know it was time to throw the towel?
So I started out trying to use a nasal mask, and no one was convinced that I was a mouth breather, chin strap, but every time I would get into the deepest sleep, my chin would drop and I would leak, and it would wake. It was more disturbing than my snoring to Glenn and I. So it was kind of okay, do you want to listen to wind blow or do you want to listen to snoring? So we were like, okay, snoring's not so bad. Again, totally ignoring the fact that this is like taking days off my life, which is so bad. Denial. I mean, I was in denial. So then I would just like go get a new study and say, okay, can we try? Oh, they came out with the microfoam mask. Wait, memory foam mask.
Memory foam, yeah.
Oh, okay.
Air touch.
Air touch, life changing. Okay, air touch, I could actually wear. So I have a very thin face, and so that would actually work. But again, if I got into a deep enough state of REM, which I want to be, my chin again would drop all the way to my clavicle. And the older I got, the worse I got. And I'm like, oh my goodness, I'm this little old ladies in my sleep center that I used to see. Like, you know, they would just, it was so hard to get a seal. And here I am, one of them. So that, and then I started getting pneumonias. Like I had 4 pneumonias in 2 years. And I started to think, okay, am I not cleaning this good enough? And, you know, I had the best therapists at my hands and doctors to like really work with me. And they're just, it was either just sleep on your side, which I've had 2 lumbar disc replacements, 2 fusions. I at one point I could not sleep on my side at all. Like I had to sleep on my back. And so when you sleep on your back, your snoring is even worse and your apnea is even worse. So another reason why I was like, I got to get this treated so that I can sleep on my back. So still now, I mean, Inspire doesn't guarantee that it'll reduce all, it won't eliminate all snoring, but it will reduce your snoring. And so there are some nights where if I don't crank it up a little bit, like if I had wine and I'm on my back, I might snore some. And so then I have to just go up, I'll roll over and just turn it up a level. I wish it had, and I think this is coming in the future, kind of like the AutoPAP increases on its own. I think we'll see this technology improve in a lot of ways. And I do think that we will see it'll detect, you know, oh, here she is having apnea. We better crank it up a notch. Because if I have it too high, it sometimes will wake me up when it kicks on. So I'm just.
Is it ever painful, or is it more just like discomfort?
It's like a TENS unit. I mean, the thing that was painful is like it dragging across your teeth. Like it shouldn't do that. Like
yeah,
it shouldn't be painful. It could be a little bit. It's like a humming, and you really do get used to it. It's. I'm laughing because my husband just got hearing aids, and I said you have to get used to that. You can't just like expect to, you know, it's going to be overnight cure. That's another thing I tell everybody. Inspire is not an overnight cure. Like you have to be willing to work with it. Go to your appointments, work with your sleep provider. Like we're with you. We want to be your partners for life. Like sleep disorders are for life. And we want you to have a long life, right?
And oral appliances and CPAP are both like that too.
Yep, it is. It's not an overnight fix. The thing, so it's kind of like a TENS unit. The stimulation that you'll feel, if you've ever had that little bit of a vibratory, sometimes I don't even notice it. Like I'll sleep so good now that if I do wake up, it's like, is it on? You know, then I forget to turn it on because I've done that before.
Yeah. And then what about like after the 11 years when the battery has to be changed, what happens?
So you go back for like a quickie outpatient surgery and they switch it out.
Okay. It seems, yeah. I want to read just some stats from this study. I think Inspire was FDA approved in 2014. Is that right?
Yeah.
So it's been around for a little while because it was studied before that, but they had 126 participants in the study. 83% were men. The average age was 54.5 years. Average BMI was 28.4, so a little overweight, but not, you know, I think they excluded people who were morbidly obese. And the median AHI at 12 months was 68% reduced, so from 29.3 to 9. And then the ODI, which is the desaturation, oxygen desaturation index, was a reduction of 70%, 25.4 to 7.4. And those are events per hour. And they selected people with an AHI of 20 to 50. So they didn't take people mild and they didn't take the very, very severe. And it was BMI over 32 that they excluded. Also neuromuscular disease, pulmonary artery hypertension, COPD, severe valvular disease, recent heart attack. Those are some of the things they excluded people. Or if you had really big tonsil hypertrophy, then I think that was also exclusionary. But that's just for people who are watching who might be interested. I think the other thing was central or mixed apnea over 25%. And then if you didn't have significant supine AHI, so if your supine AHI was less than 10, I think they also excluded you. But yeah, that's great. And I think they only had 2 people who had a severe side effect, and that was really related to discomfort, and they needed to have the device repositioned, but no death or anything like that.
So we implanted over 200 patients last year, activated 209 patients. And
Wow.
out of all of those, we only had 1 infection.
Wow, that's great.
Diabetic, yeah, just there was a lot of complications. He had a lot of underlying things that would, cause him to have. I didn't get an infection, and that's like Mrs. Itis. That's my nickname. So yeah, and you guys, I had COVID in December, and I did not get pneumonia. I did really well.
You bounced back really quickly.
Well, I got the monoclonal antibody.
That's right. That's right. That's right.
Thankfully, because I don't know. And I did go skiing, I don't know, a week and a half ago, and I was stuck in wind. I'm like, okay, I'm feeling.
You could tell.
Well, some of it, I wonder if it's not from my ejection fraction because of all the chemo I've had. I don't know. And my heart, it is what it is. I'm here. I'm thankful. I get to do the things I love to do, but I could only ski a half a day. And then there was no lodge open. So we would just ski until we were dying. And then I'm like, okay, let's go back. And we sat in the hot springs. Oh gosh, it was so cool. And then those minerals are really healing for me. But yeah, I've traveled twice since I've had COVID and recovered nicely. And again, I think treating my sleep apnea has a lot to do with the fact that I feel amazing. And I'm so grateful that I'm still here. And if I could encourage anybody or answer any questions, like you're watching, if you have any questions about this amazing new technology, Inspire, I'm here for you. I'd love to guide you through. I want to ask about what you're doing. So would you tell us, Sleep Guru, you're just launching your website? Did it go live?
Yeah, it is. I'm gonna, hopefully announce that tomorrow. But if anybody's watching, please go look at it. But yeah, so when COVID happened, we started seeing. I was in a private practice, and we actually did Inspire there, but the owner did more of the management. But we would talk, so I kind of knew about it, and I referred patients for it. But anyway, I got off the topic. We started doing just telemedicine. And I do a lot of CBT-I since I'm board certified in it. And I just thought, I'm licensed in California and Alaska too, just from previous jobs. This is maybe a really good time to just start a telehealth practice. So that's what I'm doing. So my practice is home sleep apnea testing. Just because, as you said very early in the session, a lot of people with insomnia actually have sleep apnea. And so if that's what people need, I can point them in that direction. But I'm mostly doing CBT-I and for people even just that want to have an assessment of their sleep and find out how can I improve it, how can I optimize it, 7-day actigraphy, putting together sleep plans and just seeing how can we make the most and optimize our health through sleep. Because I think it's so underutilized and it's accessible to anybody with the right information.
Do you see pediatrics?
I do. I don't very often see little kids, babies and maybe say under age 5, but I did spend a lot of time early in my career working with Carol Rosen, who's a very famous pediatric sleep doctor, and I used to staff a resident clinic with her at Rainbow in Cleveland. So I got a lot of exposure. But since I'm an adult neurologist, I do tend to see more adults. Do you guys see many children?
Yeah, we do. We have 2 pediatric sleep medicine physicians. And then some of our NPs will see pediatrics as well. So we do a lot of kids here, a lot.
You guys do everything.
We do everything. That's what I wanted to do. I wanted it to be one-stop shop. So are you using WatchPat for your home sleep test? What do you use?
I am using WatchPat 1.
Awesome.
It's just so easy because, and I actually think the technology is really amazing. And I've been able to compare it with PSG and a few patients, and I'm really impressed by it. You're using it too, right?
Yeah, we are. In fact, I'll throw this out there for those of you who are in Arizona. I bought too many at the beginning of the pandemic. And so I'm running a February flash special. If you book your appointment for a consult by the end of February, you can get a consult, a disposable home sleep test, which is a WatchPat, and a follow-up for $300. So,
wow, that's awesome.
Yeah, so those are for cash pay because I need to use these WatchPats up before their batteries expire.
What do you think about them so far? I mean,
I did one during my Inspire thing. They needed to see sort of where I was at. So instead of going into the lab, I did a WatchPat, and I have one that's in the car.
I have one here.
Let's show it. Yeah, it's so easy. It's so simple to use. And I mean, honestly, you're basically getting like, for that price, this for free, because these cost us $100.
My brother wore one and he just thought it was amazing. So it looks like this. It's called WatchPat because it's almost like a watch. And then let me put this on. So you download an app on your phone. So you do need to have a smartphone. And then you pair it with a PIN number to your app. You put this finger sensor on, and then there's a little electrode here that you put it on your sternum. So you can see that. And that's it. And you just push start. And then you wear it overnight. The data uploads to the cloud. I can look at it, and then you can throw this away. And for COVID, that's wonderful because you're not touching anything anybody else has touched.
Right.
This is in a box that's sealed when it comes to you. And I think this technology is really underutilized. I know the VA is using it. I know Kaiser out here is using it. But as a neurologist, knowing that we're really looking at, the autonomic nervous system, and we can look at arousals in a way we can't usually with home sleep testing, I'm very impressed by it.
I'm glad you like it because some you're either yay or nay, right?
Yeah. I love it. I'm all for it.
The train has left the station. Get on.
I know it has, because I feel like, I'm all about it. But I'm glad you brought that up.
So you can see patients on telemedicine in California, Alaska, and Washington. Right? Okay.
Yeah.
Great. Yeah. Well, I love that you're doing all you're doing. I can't wait to see how well you do it. So you probably don't, are you just working from home, or do you have a little office that you go to? So no overhead.
Yeah, I'm just working from home right now. I think I am going to get an office, but I kind of want to wait until COVID slows down.
Yeah.
Because I'm sure, as you know, there's a lot of things to worry about in terms of like cleaning, and since I'm just starting up, I'm probably not going to be that busy right away. So
yeah, well, and infection control is, one of the things that I like to talk about. So, for those of you watching here in the Phoenix area, don't be afraid to come in, because we have to follow the CDC and Arizona Department of Health guidelines. Like they govern us. Like, you have your own private room, your own private bathroom. There's even a shower for you to get ready for work. You'll have your own private sleep tech. Our sleep techs only run 2 studies a night. So, it's safe. Most of our sleep techs have been vaccinated. Hallelujah. So if you want a vaccinated sleep tech, just ask. Hey, maybe you could talk as a sleep doctor, because I get asked this a lot, but I want you to tell our audience here the differences between having an in-lab study and a home sleep test, so that they can kind of understand, really the benefits versus, can maybe give us some pros and cons of each.
Yeah. So when I'm thinking about that, the diagnostic implications are the most important. So A home sleep apnea test is only testing for sleep apnea. That's it. It's not going to test you for any other sleep disorder. It's also only really looking at your breathing and oxygen. It's not looking at arousals. It's not looking at leg movements. It's not looking at staging sleep. Now, there are some advancements in this WatchPat one that we talked about where you could tell a little bit more than the older types of home sleep apnea tests where you're wearing a nasal cannula. But the home sleep apnea test is used because it's easier. You get to sleep at home, and there are less electrodes. But diagnostically, it's not as good at differentiating between the types of sleep apnea, especially when they're more complex types. And it's not really helpful if you're thinking about parasomnia, periodic limb movements, seizures, narcolepsy. So it depends what you're worried about as a doctor, whether you're going to recommend one over the other.
Yeah, that's awesome. I think when it comes to Inspire, we have kind of found that it's really important to have a PSG, an in the lab study, if you are going to go the Inspire route, because we really need to make sure that you meet those indications, because we want it to be successful. Because sometimes the way we score a home sleep test, your apnea hypopnea index might be a little bit lower than it would be in the lab, because how she said we don't see arousals in the brain. Your apnea hypopnea index could be a little bit different on a home sleep test versus in the lab. And then we also need to look at periodic limb movements versus, central sleep, sometimes, and I don't know that technology that well about WatchPat, but central sleep apnea, if you have more than 25% centrals on your in the lab, your PSG, then you would not qualify for Inspire. How do you feel about the WatchPat and its ability to pick up that central sleep apnea component?
I'm not sure that it's much better, but I do think that with the arousals, there's more information, because I think part of that peripheral arterial tonometry is linked to that, the sympathetic tone.
Yeah. So would you feel confident if you saw a WatchPat study, and if they, were like, I just can't wear this CPAP, anymore. Like I'm getting sick, or I'm I'm done. I'm claustrophobic. Would you feel confident sending them for an ENT evaluation off the WatchPat, or would you feel better looking at a PSG, or what would you do? Just curious.
I would. Unless it wasn't covered by insurance and it was going to be really cost prohibitive to the patient, and I would, just because that's how the guidelines, as you said, were set out. And I think you need to rule those things out. Yeah. And you need to know what the true AHI is. You want to know that going in, and you want to measure with the same test after too, right?
Well, yeah, and I'll tell you what happened with me. So I did a home sleep test to kind of see where I was at. I had an old study, but it was not within 2 years. So I did an apnea link, and my AHI was around 23, 25, something like that. But Dr. Mohan said, I can kind of see some periodic breathing component here, but we need to, make sure. And my dad had central sleep apnea, so I wanted to make sure that I didn't have centrals. So I did the PSG to make sure I didn't have centrals. Well, I didn't have centrals, but my AHI was like 63 point something. So, so good thing I almost didn't qualify for Inspire. But anyway, someone asked about if you need MRIs. So MRI, in fact, so I have been getting an MRI CP every year because I have an ATM gene mutation that I say doesn't pass out money, it passes out cancer. So
oh my gosh, you're so funny. I love your sense of humor.
Well, you have to laugh. I mean, what can you do? So they're watching me. It causes breast and pancreatic cancer. So they like to watch my pancreas once a year. And so I thought, oh, I'm going to be in so much trouble when they find out I just went and did this MRI thing or Inspire. Anyway, so I get up there and I see the research oncologist, and I'm like, oh, by the way, I have this. And he was like, wow, that's amazing technology. I've read about that. You have that? And so, and I said, well, you know that I'm probably not going to be able to get my MRI. He's like, well, let me talk to the rep. And then anyway, we ended up just doing a CT because, you know, they don't want me to do CT because of radiation, but it's like, I'm going to get the same amount of radiation hiking up Camelback Mountain as I would getting a CT. I felt like treating my sleep apnea was more important than me worrying about getting pancreatic cancer. And hopefully with all this mRNA research, they're going to be able to draw my blood in a couple of years and tell if I'm going to get pancreatic cancer.
I think they're going to be able to. Yeah.
And
And they're going to be able to treat it too.
that'd be great. Oh my God.
I really think all this is going to, you know.
The silver lining, right? It's
yeah,
so devastating, but it's a silver lining, and it is exciting because to me, I lost my aunt to pancreatic cancer, and you know, it's important. What other questions? My audience out on Facebook or the webinar, or anybody here that's watching on Instagram, what other questions can I answer about Inspire? I can show that. Some people are just joining. ValleySleepCenter.com, that Ask a Sleep Coach box that pops up when you first log on, that comes directly to my email. I'm the sleep coach. So if you know, anybody has questions along the way, you want to learn more about how to introduce Inspire into your practice, I'd be happy to. Actually, we're doing February 11th. Oh, I'm not going to get the date right. It's a Monday. Yeah, we're doing, no, it's not. It's like the 22nd, February 22nd. I think that's a Monday night. I am hosting a deep dive into Inspire nationwide to show sleep doctors and practices how they can integrate what we've done here at Valley Sleep Center with Inspire. I feel like it's been just life-changing for so many patients. And, you know, it's not just bringing the non-adherent patients, it's bringing the untreated, and anybody in this industry has a huge heart for the undiagnosed. Like that's our biggest reach, right? The undiagnosed, the young people that they don't want to go get their sleep apnea treated because they don't want to wear CPAP. And now they're learning about something like Inspire, ending up on CPAP and actually loving it. So CPAP is still that gold standard. Maybe they get an oral appliance, but how cool that there's a new treatment on the block that works in the neuromodular world. I mean,
how do we sign up for that?
I can send you the link. Let's see.
Is it on the website?
I wish it was on my website. I will.
Oh, someone just put it on the chat. Yeah.
Thank you. Oh, they're here. February 22nd, 6 p.m. Central time.
Okay. And I'll put it in my Instagram link tree as well.
Yeah, would you? That'd be great. Oh, and that's another thing. If you guys want to see more of our CHTs, you can text the word sleep to 474747. Or if you have anybody out there that you want to show my story, if you have them text no mask to 474747, you'll get like a little 2-minute video that I did here with the local news. And again, Valley Sleep Center's YouTube, Valley Sleep Center, lowercase, all one word. There's tons of videos out there from all my stuff. And then if you want to see what we're doing the rest of February, I think we're doing on next week, How Sleepy is Your Valentine? But it's about sex and sleep. So I'm kind of taking a deep dive into a sex campaign as well, because sleep and sex are so important, and it's the essential needs for our humanness, right? So
very much so. That's so great.
Jumping off that cliff now.
Yeah, I saw some of your programs with you have a behavioral sleep medicine person on your.
We do. Yeah, and she actually has her PhD in human sexuality, so she has a lot to offer.
How interesting.
Dr. Duffy, she's a hoot. She's a lot of fun.
Is she on Instagram?
I don't think so.
Okay. Well, I need to come to one of our webinars. I signed up for one and I missed it, but I was like, this woman looks fascinating.
Yeah, well, she's and she's a lot of those are recorded. So if you just go to YouTube, Valley Sleep Center, all lowercase, you watch them. So,
Oh my gosh. Well, thank you for all this amazing content. And it's so nice to meet you.
oh, you're very
Thank you for
welcome.
your time.
All right. Thank
All
you.
right. You're
Have a great night,
welcome.
everyone. Bye.
Take care. Bye.